Hello everyone, welcome to Pediatrics by Dr. Anand. So now today again we are going live just for 3 to 4 minutes to highlight important points regarding nephrotic syndrome. Today's session will be just to 2 to 3 minutes where we will be talking about nephrotic syndrome. So nephrotic syndrome, before coming to nephrotic syndrome, the patient in general presents to you with anasarca. Yes or no? So can anyone tell me what is anasarca? Any random guesses? So generalized limb swelling, generalized body swelling is nothing but anasarca, right? The patient in general of nephrotic syndrome presents to us with the scrotal edema, could be a pedal edema, could be a anasarca. Hi Dr. Sumant, welcome to Pediatrics by Dr. Anand. And in this session for 2 to 3 minutes, just important highlighters regarding nephrotic syndrome we're going to talk about. So can you tell me, like, what are the differential diagnoses of anasarca? What a patient comes to with generalized swelling. So every swelling is not nephrotic, right? So what do you think? What are the important differential diagnoses of anasarca, and how will you come to nephrotic syndrome? So you know that, right? So most importantly, the differential diagnoses of anasarca are, of course, if you're talking about nephrology, nephrotic syndrome, yes. Number two, any random guesses? So congestive cardiac failure, congestive cardiac failure patient also can land up into anasarca. Again, like for example, portal hypertension, portal hypertension patient also can land up into anasarca. Basic malnutrition, a patient of Kwashiorkor, so he is also landing up into anasarca. Or a basic anemia also can present as anasarca. So the important differential diagnosis of anasarca are anemia, malnutrition, congestive cardiac failure, nephrotic syndrome, and portal hypertension. In that also you need to differentiate, right? If I talk about congestive cardiac failure, how will you differentiate? What are the signs of right heart failure and what are the signs of left heart failure? Can anyone tell me any random guesses? What do you think? What are the symptoms and signs of right heart failure? So if I talk about right heart failure, you know that the patient will have periorbital swelling, the patient will have facial puffiness, the patient will have raised JVP, tender hepatomegaly, ascites or effusion, scrotal edema, or bilateral pedal type of edema. These are the symptoms of right heart failure, right? Very good. And yeah, so Dr. Prakash is very right. We had discussed in the triads class also, tachycardia, tachypnea, and tender hepatomegaly comes as a triad of congestive cardiac failure. And if I talk about left heart failure, the patient he'll be very sick looking, distress, crepitations, all those additional sounds, right? So this is congestive cardiac failure. Now coming to nephrotic syndrome. So can you tell me any important highlighters of nephrotic syndrome? Like the patient presents with other than anasarca, what are the important points which you should know in case of nephrotic syndrome? So what do you think? Put your answer in the comment section. What do you think? So most importantly, massive proteinuria. Very important. Not just proteinuria, it is massive 3 plus or 4 plus proteinuria. Number one. Number two, hyperlipidemia. Serum cholesterol more than 200 milligram per dl. Number three, hypoalbuminemia. Okay, hypoalbuminemia and bilateral pitting type of edema. Very good, Dr. Prakash. Very good. So very important. Very good, Sumant. So hyperlipidemia, massive proteinuria, hypoalbuminemia, and very important, bilateral pedal type of edema. So can anyone tell me, do you see, like if I say massive proteinuria, right, means there is in the urine I have proteins positive, right? Proteinuria. So my question is, like, do you see normally proteinuria? Can anyone tell me, people who are live, do you normally see proteinuria in a patient? If you are in my urine reports, will you see proteinuria in my normally? Is it there or it is not there? What do you think? Normally, do you see proteinuria in a patient or not? Yes, we have Elizabeth. Hi, Elizabeth. Welcome to Pediatrics by Dr. Anand. So yes, we see proteinuria. Remember, less than 4 milligram per meter square per hour. Less than 4 milligram per meter square per hour is normal proteinuria which is seen. Okay, very important. See, remember one mnemonic. Okay, less than 4, 4 to 40, more than 40. Less than 4, 4 to 40, more than 40. Less than 4 is normal proteinuria. 4 to 40 is non-nephrotic range proteinuria, and more than 40 milligram per meter square per hour is nephrotic range proteinuria. Very important for examination, important for diagnosis, as well as for the exam purpose also. So we have non-nephrotic range proteinuria and nephrotic range proteinuria. So less than 4 milligram per meter square per hour is normal proteinuria. 4 to 40 means 4 to 40 milligram per meter square per hour is non-nephrotic range proteinuria, and more than 40 milligram per meter square per hour is nephrotic range proteinuria. You should know that. Okay, so that covers the important points on nephrotic syndrome. Okay, so can anyone tell me what is the what is the treatment, what is the drug of choice for the first episode of nephrotic syndrome? What do you think? What do you give? Any idea? Elizabeth, what do you give in nephrotic syndrome? First episode of nephrotic syndrome, what do you give? Any random guesses? Yeah, very good. So yes, we have Dr. Preacher. Very good, Prakash. So steroid, which steroid do you want to give? So prednisolone, that is the first point. How much should I give, sir? For how many weeks should I give? First episode. So 2 milligram per kg per day of prednisolone for 6 weeks, followed by 1.5 mg per kg per day alternate day of prednisolone for next 6 weeks, so total of 12 weeks. Are you understanding? Very important question. I'm covering very simple. I'm telling you, I will not tell you tough things are there in our app, but right now the basic I'm telling you. So the first episode of nephrotic syndrome, you give 2 mg per kg per day of prednisolone, followed by 1.5 mg per kg per day of prednisolone for the next 6 weeks. That is the first episode of nephrotic syndrome. Very good, Elizabeth, very good. And can anyone tell me what is the drug of choice of steroid dependent nephrotic syndrome? What do you mean by steroid dependent nephrotic syndrome? Have you heard the names? Steroid dependent, steroid resistant nephrotic syndrome, remission, relapse. Very basic terms, important for your basic education being a pediatrician. So what is steroid dependent nephrotic syndrome, Elizabeth? Can you tell me what is the meaning of steroid dependent nephrotic syndrome? Who can tell me that? Please tell me. So, yeah, very good, very good. So, steroid dependent nephrotic syndrome is that within 14 days of discontinuation of steroid therapy, I am coming to you as a relapse. Are you understanding? Within 14 days of discontinuation of steroid therapy, I am coming to you with a relapse. That is known as steroid dependent, means I'm dependent on the steroids. Are you understanding? There are 4 terms you have to understand. Okay, remission, relapse, steroid dependent, and steroid resistant. If these 4 you know, you have covered much of the topic. Number 1 is remission. What is the meaning of remission? Remission means कि patient ठीक हो रहा है. The patient is getting all right. That is the meaning of remission. Like if I talk about the book terms, remission is early morning 3 consecutive day samples. Urine protein is nil or trace. That is known as remission. Remission matlab the patient is getting all right. It's a very important point. You need to know them. What is remission? Sir, in early morning 3 consecutive day samples, I am heating your urine in a heat coagulation test, and I am finding that your urine proteins, your proteins in your urine are nil or trace. In nephrotic, I should found your urine proteins 3 plus and 4 plus, like a cloudy precipitate after heating your urine in the heat coagulation test. But remission means you're getting all right. So I expect that your urine protein should be nil or trace. That is the remission. Patient is getting all right. What is relapse? Relapse means patient again getting a problem. Means in the book terms, if I talk about early morning 3 consecutive days sample, urine protein is again 3 plus and 4 plus in a patient who was in remission previously. This is a very important definitions for the newcomers. You again, after recording the whole video, you please watch it again if you don't know. I'll repeat again. What is relapse? Early morning 3 consecutive days my urine samples, in my urine protein 3 plus and 4 plus in a patient who was in remission previously. That is known as relapse. Third is steroid dependent nephrotic syndrome. So steroid dependent means within 14 days of discontinuation of steroid therapy, again I'm coming to you with relapse. That is known as steroid dependent. And last but not the least, steroid resistant. What is steroid resistant nephrotic syndrome? Steroid resistance, any idea? So steroid resistant means you're giving me steroid, still my swelling is not going down, right? That is the meaning of steroid resistant. So steroid resistant, the definition is like you are giving me prednisolone 2 mg per kg per day for continuously for 4 weeks you gave me, still my body is not going into remission. Are you understanding? Yes or no? So 2 mg per kg per day of prednisolone you are giving me for 4 weeks, still my body is not going into remission, means my body is steroid resistant nephrotic syndrome. And the drug of choice of steroid, this, are you understanding? Very important, actually, very important. So very good, Elizabeth, very good, so proud of you. So drug of choice of steroid dependent nephrotic syndrome is, the mnemonic is cycle. Okay, cycle, cyclophosphamide and levamisole. Are you understanding? So AIMS question number 1, what is the drug of choice of first episode of nephrotic syndrome? The answer is prednisolone. Second question, what is the drug of choice of steroid dependent nephrotic syndrome? The mnemonic is cycle. Cycle matlab cyclophosphamide and levamisole. If both option comes in your exams, which one to choose? So remember L, levamisole is the first drug we start. If the patient not responding, then we go for cyclophosphamide. So are you understanding? And last but not the least, the drug of choice of steroid steroid resistant nephrotic syndrome. Then remember, like resistant, right? Remember CT scan. Okay, so CT, so C for cyclosporin and T for tacrolimus. That's it. Are you understanding? So that we have covered important points of nephrotic syndrome. What is remission, relapse, and steroid dependent, steroid resistant, drug of choice. And last question, what are the indications of renal biopsy in nephrotic syndrome? So who will tell me now? So Elizabeth, what do you think? What are the indications of starting of doing a renal biopsy? At least, can you tell me two important indications? You gave me a call saying that, sir, I did a renal biopsy of this patient of nephrotic syndrome, and I'm like, why did you do a renal biopsy for a nephrotic syndrome? You could have started prednisolone. So what are the indication? Very important question for pediatricians and for MBBS students. So important indications of starting of doing a renal biopsy in nephrotic syndrome are: number one, if the patient presents to you with age less than 1 year or more than 8 year. That is the first point. Okay, very important. Age less than 1 year or more than 8 year. A patient presenting you to you with the symptoms. Okay, first. Second, very important. So persistent hematuria. Lot of blood. Persistent hematuria. You should. Number three, hypertension. Presents to you with hypertension. That also, you can, what you call, start the you need to do a renal biopsy. Age less than 1 year or more than 8 year, persistent hematuria, persistent hypertension, very important. These are the very important indications. And in some books they says before starting even cyclosporin or tacrolimus, you should do a renal biopsy. So that's it. So that was all about nephrotic syndrome. Thank you so much for the participation. We have covered important points regarding nephrotic syndrome. Thank you, Elizabeth. Thank you, Apurva. Thank you so much for coming. Thank you for attending all the important classes. I hope you are liking it. Today we had a class on fetal circulation. I hope you had a good time, and in a very simple way I tried myself to present it. Rewatch this video if possible, because if you're a newcomer, if you don't know, it will be really nice. So yeah, thank you, Elizabeth. Yeah, thank you, Girish. Thank you so much for everything. Bye bye, good night, and a happy Karwa Chauth. Bye, Sumant. Bye, Akash. Thank you so much. Bye, Sudarshan. Bye, Dr. Girish Raheja. Thank you. Bye. So Elizabeth, you presented nephrotic syndrome in your class. Okay, that's so nice. I mean, these points will be really helpful for you. Akash, thank you so much.